Hi everyone, my name is Sarah Venice, and today I'm going to be talking to you about and presenting a case study on breast cancer. So what is cancer? The medical term for cancer is neoplasm, and that's an abnormal growth of tissue. And in cancer, normal stem cells are damaged, the DNA is damaged, and the cell can no longer function the way it's supposed to, and this abnormal cell replicates. At the bottom of the screen, you can see here, there's a nice image that shows the stages that a healthy cell goes to become cancerous. So there are 4 different types of cancer. There's sarcomas, which are cancers of the bone, muscle, and cartilage; lymphomas, which are cancers of the lymphatic system; leukemias, which are cancers of the bone marrow and blood-forming organs; and last but not least, carcinomas, which breast cancer falls under, and those are cancers of the epithelial tissues. So what exactly is breast cancer? A mutation occurs in the genes of the cell. This unhealthy, abnormal, and new cell continues to replicate, and all these replications form a tumor. The tumor can either be malignant or benign, and a malignant tumor is harmful to one's health, while a benign tumor is not harmful to one's health. And metastatic cancer is when the cells of the malignant tumor spread, usually through the lymphatic system, to other parts of the body. There are 3 different chemicals that can accelerate cancer growth in a cancerous cell, and those are estrogen, progesterone, and HER2 receptors. HER2 receptors normally help a breast cell to grow, divide, and repair, but in a quarter of cancer patients, this gene isn't functioning properly, and replication can become uncontrolled. So at the bottom of the screen, you can see here there's a nice diagram of a normal breast cell with a normal amount of HER2 receptors, and then an abnormal breast cancer cell, and the number of HER2 receptors is significantly increased. There are 9 stages of breast cancer: 0, 1A, 1B, 2A, 2B, 3A, 3B, 3C, and 4. And how you determine what stage a breast cancer person is in depends on the size of the tumor, the number of lymph nodes that have cancer, and whether the cancer has spread to other body parts. And treatment depends on what stage the patient is in as well. So signs and symptoms. Oftentimes with breast cancer, there aren't many signs and symptoms, or the tumor is too small to detect by oneself. And it is recommended that girls of all ages and women do a monthly self-exam on their breasts to feel for any abnormal tissue or lumps. And it is also recommended that women starting at the age of 45 get annual mammograms, because if the lump is too small to detect, a mammogram can detect this. And some other symptoms may also be swelling of the breast, breast pain, irritation or dimpling of the breast, a nipple pain or turning inward, reddening, scaling, or thickening of the nipple or breast skin, a lump in the underarm area, and discharge from the nipple that is not breast milk. So there are several risk factors for breast cancer. Some of them are unavoidable and other ones are avoidable. So some of the unavoidable risk factors include age, gender, race, family history and genetics, health, menstrual and reproductive history, gene mutations, and having a dense breast tissue. And some avoidable risk factors for breast cancer are a sedentary lifestyle, obesity, poor diet and high alcohol consumption, having radiation therapy to the chest before age of 30, and combined hormone replacement therapy. So exercise does have several effects on breast cancer. Studies show that regular physical activity can reduce the risk of developing breast cancer. And if you've already been diagnosed with breast cancer, regular physical activity can reduce the recurrence of breast cancer. Exercise helps maintain a healthy weight, and it is found that more women who are obese tend to be diagnosed with breast cancer, and it can also ease the number and severity of treatment side effects. So you can have less nausea from chemotherapy, less fatigue from chemotherapy and radiation, improved blood flow to the legs, and also a reduced risk of blood clots. And chemotherapy also decreases strength and muscle mass, and exercise can help gain this back and reduce the loss of that. There's a lot of research out there that shows the positive effects of exercise on breast cancer patients. To the left here, there's a nice table that summarized 3 different studies that shows that greater levels of physical activity and in general levels of physical activity can reduce the mortality in breast cancer patients and also lower the risk of recurrence of breast cancer in patients. Then there's also to the right here a very interesting study done by the University of Pennsylvania that shows that more exercise reduces estrogen-sensitive breast tissue in women that come from high-risk families for breast cancer or have genetic mutations that increase their risk for breast cancer. So a lot of tumors spread by taking over estrogen signaling pathways. And this study focused on 3 groups: a control group which exercised less than 75 minutes a week, a low dose group which exercised 75 minutes of 150 minutes a week on the treadmill, and then a high dose group which exercised 300 minutes a week on a treadmill. And the results showed that the control group had an estrogen sensitive tissue increase of 20%. The low group decreased estrogen sensitive tissue by 8%, and the high group decreased estrogen sensitive breast tissue by 12%. That shows that with about 100 minutes of physical activity, there's a 10% drop. And this is huge in decreasing the risk of breast cancer in high risk women. And it also can help decrease the severity and the stage of breast cancer if they should be diagnosed. So there's lots of treatment and medications for breast cancer. Surgery, you can either have a lumpectomy, where part of the breast tissue is removed where the tumor is, or mastectomy, where the entire breast is removed. Radiation therapy uses high-energy X-rays to kill any cells that remain after surgery. Chemotherapy are drugs that kill or disable the cancer cells. Hormone therapies, earlier I talked about 3 different chemicals in the body that can contribute and help cancer to spread and grow, and these prevent the cancer cells from getting the hormones they need to grow, and they slow and stop the growth of tumors that have too many hormone receptors. Targeted therapies are drugs that attack certain molecules or pathways of cancer, such as a specific gene protein, but these types of therapies can be limiting because in order to perform it, you must know what target pathway is causing the cancer, and sometimes that can be difficult. There's also a variety of drugs that are used in conjunction with these treatments, and that help to reduce pain. The effects of treatment and medications on the exercise response. Breast cancer surgeries can increase the risk of lymphedema, which is swelling in the tissues of the arm, trunk, breast, or hand. And this can cause numbness, infection, and discomfort. So activities using the upper extremities, and that might put too much stress on the arms, such as push-ups, pull-ups, ellipticals, swimming with large arm strokes, all of these will want to be monitored closely and modified. Radiation can increase fatigue and anemia, so it's important to start working out at lower levels and gradually progress the level of physical activity. The treatments may also lead to neutropenia, which is a low white blood cell count, and this can reduce the ability to fight infection. So someone with this will want to avoid public gyms or places where they have an increased risk of getting an infection. And thrombocytopenia, or low platelet count, may occur due to treatment, and this increases the risk for bleeding and bruising. So it's important with that to avoid contact sports with that also have a high risk of falling. Hormone-related cancer patients tend to see increases in weight gain, and this weight gain may be difficult to lose. So exercises may need to be modified according to that, and also potentially increase if they have the ability to do so, to try and get rid of that excess weight that the patient has gained. It's important also to remember that every case is different. So someone may start out having breast cancer, but it could potentially spread throughout the body to another part, and this will, wherever it spreads, could affect the exercise response differently. So contraindications to exercising with breast cancer, there are several. Having a hemoglobin less than 10 grams per deciliter, having less than 3,000 milliliters white blood cells, having a neutrophil count less than 0.5 times 10 to the ninth, or platelet count less than 50 times 10 to the ninth milliliters, having a fever greater than 38 degrees Celsius, having an unsteady gait, losing greater than 35% of premorbid weight, having limiting dyspnea with exertion, bone pain, severe nausea, extensive skeletal metastases, and Upper body exercises should be avoided within the first 4 weeks after breast cancer surgery or axillary lymph node biopsy. Originally, it was thought that upper body exercises should be almost completely avoided altogether to reduce the risk of lymphedema, but now studies are showing that the benefits outweigh the risks of lymphedema in breast cancer patients, and to just modify or delay those upper body exercises a little bit. So here's a case study. This woman is 35 years old. She has a BMI of 24.5 kilograms per meter squared. She currently has stage 1A breast cancer. The tumor is less than 2 centimeters. She has no cancer in the lymph nodes and no metastases. She had a lumpectomy done 6 weeks ago to remove the small tumor on the breast, and she's currently undergoing radiation to remove any cancer cells that may be remaining. And before diagnosis, she's very active, loves being outdoors, participating in activities like jogging, biking, and hiking, and she enjoys lifting weights. And her long-term goal is to get back to the level of physical activity that she was at prior to being diagnosed with breast cancer. So we'll perform a risk stratification based on the ACSM guidelines. She's 35 years old, so she's okay with her age. She has a BMI of 24.5, which is normal. Her blood pressure is 124/80, so she's pre-hypertensive. Her total cholesterol is 180, triglycerides 90, LDL 130, HDL 45, so she is okay with those numbers. She's a non-smoker. Her mother had a myocardial infarction, but it was at the age of 70. She's very active, loves to jog, hike, and bike. She does not have any contraindications to exercising with cancer, and she experiences some low levels of fatigue due to radiation and also experiences some moderate nausea occasionally. So she is considered low risk. However, she is a breast cancer patient who had surgery and is still undergoing radiation, so her exercise program must be modified accordingly. As far as exercise testing goes, an exercise test is not typically performed, and complications could arise with an exercise test in cancer patients, but it's important to get the permission from the patient's oncologist to start an exercise program and to have them fill out a modified PAR-Q to evaluate the pre-exercise risk. So for aerobic exercise, she'll want to begin large muscle activities such as walking or cycling at a heart rate reserve of 40 to 60%. And because she's undergoing radiation, we're going to start with that lower percentage and eventually work up to 68 to 80% of heart rate reserve. She'll do that 4 to 5 times a week, 150 minutes a week at that moderate intensity, and eventually work up to greater than or equal to 75 minutes a week of vigorous intensity. Since she sometimes has fatigue, she'll want to start out working with a trainer or a buddy who is able to monitor her and make sure that she's okay. And they may need to be modified or sometimes skipped altogether, depending on the level of fatigue or nausea that she's feeling that day. For resistance training, you want to start with low rates and low reps, 20 to 40% of the 1 repetition maximum. You want to start working on gaining back range of motion first, because she did just have surgery 6 weeks ago, and then work up to building strength. Do that 2 times a week, 1 set of 6 to 8 reps. Machine weights, free weights, body weight. Flexibility exercises, she'll want to perform before and after exercise. Stretch the larger muscles 3 times with a 15 to 30 second hold, and hold to the point of tension but not pain, which will be about an 11 to 14 on the RPE scale. So the take-home message that I want you to get from this presentation is that every cancer patient is different. There's different types of cancers, they affect different body parts, there's different stages of each cancer, and there's different treatments and medications for all of these different types of cancer. So there's no general exercise program or guidelines to go by, and know who you're working with and tailor the program to that individual and start gradually and then progress from there. Thank you.